learners through teaching and place or the Nigerian child can go back to school. Correspondent takes a look at safety measures to be put on ground before a resumption date will be fixed. Schools have been closed in Nigeria for a while, but learning continues via various platforms.
Apostrophe is also used to show that one or more letters are left out.
In Lagos State, these children their in the classroom learning experience.
I miss my friends. I miss my school.
This COVID-19, we can overcome it so that we can all go back to school and I can complete my class SS3.
Recently, rumors went round that schools will open on the 8th of June. This was debunked by the Presidential Task Force on COVID-19, saying no date has been fixed for resumption of schools across the country. The Minister of State for Education, Chukwuemeka Nwajoba, however, urged school owners to plan ahead to ensure maximum safety for students when they return. Executive Chairman, Lagos State Universal Basic Education Board, Wahab Alawiye King, speaks from this perspective.
There is the pre-resumption, strategy we must put in place. You want to ensure that most of these schools are clean and fumigated, and in some cases decontaminated. They have been used for different kind of things during the lockdown. Also, we must establish the health and safety standard as put up by the international and local health authority.
Even as government continues to work on safety modalities, students are praying to hear cheering news of school resumption soon. Now to infrastructure. Lagos State Governor Babajide Sanwo-Olu has flagged off the construction of the long-awaited regional road in Lekki region, a critical infrastructure proposed in the Lekki-Epe master plan aimed at decongesting traffic gridlocks in Etiosa local government area, Nusa Usula reports.
Construction of the 8.7-kilometer long road will link Lekki-Epe Expressway at Victoria Garden City Junction to the Freedom Way in Etiosa. The road is also said to be a precursor to the proposed 4th mainland bridge that is expected to take off from the axis. The governor described the development as a manifestation of his administration's commitment towards improving socio-economic activities on the Lekki-Epe axis by the provision of supporting infrastructure. When completed in the next 24 months, Sanwo-Olu said the regional road would not only change the entire landscape of Etiosa and improve journey time for commuters, as it would also drive up the efficacy of government's traffic management strategy.
Keeping our promise to Lagosians. Why do we do so? Because we know our word is our bond. We know that when we give commitment as a government, we do not shy away from it. We know what this is going to take from us.
The governor said sanctions await property developers and state officials who undermine the state's planning approvals and encroach on the alignments of the regional road. Governor Sanwo-Olu directed the Ministry of Physical Planning and Urban Development to sanction any state official found culpable in compromising the planning approval and right of way of the road. He appealed to residents to cooperate with the government and the contractor towards making the project a reality. In Lagos, Nusa Usula, NTA News.
That's it from Lagos. We now take a break. Nationwide continues shortly.
I wish to once again commend the frontline workers across the country who, on a daily basis, risk everything to ensure we win this fight. For those who got infected in the line of duty, rest assured that government will do all it takes to support you and your families during this exceedingly difficult period. I will also take this opportunity to assure you all that your safety well-being, and welfare remains paramount to our government. I am using this opportunity to express our deepest condolences to the families of all Nigerians that have lost their loved ones as a result of the COVID-19 pandemic. This is our collective loss, and we share your grief.
Executive Order 10, 2020. How sustainable for representative democracy in the face of financial autonomy for state legislature and state judiciary. Plus, 5 years of President Buhari's administration. How far, so far. These are the focus on NTA Tuesday Live this week. Tuesday Live, incisive and educative. Join us at 10:30 p.m.
As a strong immune system increases the chances of victims surviving COVID-19. A corruption-free society creates opportunities for citizens to thrive and prosper. Build your immunity. Stop corruption now. Report all acts of corruption to ICPC on this toll-free number 0800 2255 4272. This message is brought to you by ICPC and NTA.
Nigerians, let us take responsibility. Stay healthy, stay safe, and curb the spread of the virus. Take responsibility. The coronavirus spreads from one person to another. Let us avoid crowd gathering of any kind for any reason. Take responsibility. Avoid traveling from one state to another during these lockdown restrictions. Obey all the rules that are put in place. Take responsibility. Stop spreading fake news and unverified reports about the coronavirus. There is no known cure for COVID-19. Take responsibility. Observe all the measures that can help stop the spread of the virus. Together, we can do this, but only if we take responsibility. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network. We have observed the lockdown. We have practiced the measures in order to curb the spread of the virus, but we can do better. The coronavirus spread is increasing daily, and only together can we cut down the numbers and defeat the spread of the virus. Remember, COVID-19 is not a death sentence, and a recovered patient cannot spread the disease. Do not stigmatize. Do not hesitate to report any case, or if you have come in contact with anybody that has been infected with COVID-19. If you have cough and fever, please stay at home and call your state hotline. Find state numbers at www.covid19.ncdc.gov.ng. Remember, it is for your own good and for the good of every Nigerian. Let us do better and defeat the virus. Together, we can do this. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Thanks for staying with us. The All Progressives Congress governors are in a meeting with the National Working Committee of the party. The governors arrived at the Secretariat at about 2 p.m. and went into a closed-door session as part of their strategic engagement to boost intra-party harmony ahead of governorship primaries in Edo and Ondo states. Salihu Abdullahi reports that in attendance were the chairman, Progressives Governors Forum, Atiku Bagudu of Kebbi State, Rotimi Akeredolu of Ondo State, Simon Lalong of Plateau State, Babajide Sonwo-Olu of Lagos State, Mohammed Inua of Gombe State, Abdullahi Umar Ganduje of Kano, Abdurrahman Abdurrazak of Kwara State, and Abubakar Badaru of Jigawa State. We'll bring you details of the meeting in our subsequent bulletin. Let's head to Maiduguri to join Mohammed for more on Nationwide. Mohammed?
It's good to see you, Ruth, and thanks for joining us in Maiduguri. Following the recent fire outbreak at Muna IDP's camp, National Emergency Management Agency NEMA has distributed 15 truckload of relief materials to the hundreds of victims to cushion the effect on their livelihood. The 8, consisting of assorted items, were brought in to assist the IDPs on the directive of the Minister for Humanitarian Affairs, Disaster Management and Social Development, Sadia Umar Farouk. Pauline Kujevana reports.
The fire outbreak at Mona IDP camp claimed 2 lives, destroyed shelter, animals and property. Hence, the State Emergency Management Agency, SEMA, sought intervention of NEMA to ease the hardship of the victims. On the directive of the Minister of Humanitarian Affairs, Disaster Management and Social Development, Sadia Umar Farouk, NEMA swung into action with the distribution of assorted items. Representative of Director General NEMA, Muhammadu Mohammed, the Northeast Zonal Coordinator Ishaya Isa Chonoko, said he was optimistic that the 15 truckload consisting food, mattresses, clothing, nets, kitchen utensils and construction materials will aid in restoring the temporary means of livelihood of the IDPs.
Because obvious that as a responsible government, attention is given to the affected population.
The representative of Borno State Governor, Babagana Umar Zulum, the executive chairman, SEMA, Yabawa Kolo, expressed gratitude to federal government for the timely intervention to alleviate the effect of the incidents and place judicial distribution of the items.
SEMA tried, NEMA tried, and other sister organizations that we are working together, even representative of Northeast Commission is with us.
Camp leaders expressed delight for the prompt intervention and prayed against such tragedy occurrence. In Maiduguri, Pauline Kujevana, NTA News.
Nearly 3 months into the closure of all educational institutions as a result of the coronavirus pandemic is raising concerns among students and stakeholders in Borno State that if it persists, may negatively impact on the sector. Yagum Subukar examines the situation in Borno State and environs with the indefinite closure of schools as a result of COVID-19 sustaining.
With the outbreak of COVID-19, which necessitated the stay at home, all schools in Borno are now looking shadows of themselves.
COVID-19 has had far-reaching consequences on education system across the globe, with Nigeria not an exception. The federal government, in a bid to contain the spread of the virus among students, announced the temporary closure of all schools nationwide. To date, schools across the country remained closed, thereby having impact on the students and pupils who are months at home.
I'm urging on the federal government to look into our studies and take the necessary action required.
We are now in a time whereby these students are about to write their SSC exams, and it has brought a lot of setback.
The closure of the school has affected the student because learning has stopped in the process.
Borno State government, in its effort to keep the students abreast of their studies and to prepare the senior secondary school students for WAEC and NECO, introduced the e-learning. Stakeholders are of the view that adequate measures should be put in place to bridge the gap created as a result of coronavirus pandemic during post-COVID-19 recovery.
With this pandemic, we are making preparations to make sure that even if when they return back, they maintain these proactive hygiene measures.
We were able to commission 3 radio stations for the lessons to be run.
It is the expectation of all stakeholders that government and other relevant authorities will expedite action in containing and preventing the spread of the virus for those anxious for education to return to school. In Maiduguri, Yagum Subukar, NTA News.
All right, that's the much you can take from Maiduguri. The Presidential Task Force on COVID-19 has started. Let's join them.
And the Honorable Minister of State Education for updates. We now begin with the remarks by the chairman of the Presidential Task Force.
Members of the Presidential Task Force, distinguished ladies and gentlemen of the press, Let me once more apologize. We had given you 4 o'clock, but we came slightly late due to the exigencies of the responsibilities that we're undertaking collectively with you in this season. However, let me welcome you all to the national briefing for Monday, 1st June 2020. When the PTF briefed the nation on Monday, 18th May 2020, we informed you that Mr. President had approved, amongst others, the extension of phase 1 of the eased lockdown so that the observed gaps in the expected impact of the national response could be closed and the gains consolidated. That action was based on the guidelines developed and published by the Presidential Task Force, working in collaboration with subnational entities and key stakeholders. The Presidential Task Force also announced the extension of the lockdown of Kano State due to the need to address the peculiar circumstances that had arisen in that state. During the 2 weeks extension, the Presidential Task Force evaluated the COVID-19 situation in the country, after which it submitted a report to Mr. President as promised last week. Ladies and gentlemen, despite partnerships, injection of resources, and collaboration, the COVID-19 has continued to ravage the world in very many ways. It has also continued to spread and claim casualties. The global figures recorded at Sunday, 31st May 2020, had risen to about 6.4 million confirmed cases, with 2.8 million recoveries and about 377,000 fatalities across 216 countries and territories of the world. The global epicenter of the pandemic has shifted from China to Europe, then to the United States of America, and is now showing significant impact in South and Central America. This shift to South America, with virtually similar climatic and demographic similarities with Africa, is a cause for concern when we consider the fact that earlier projections pointed to Africa as likely to be the worst hit continent by the pandemic. In Africa, confirmed cases stood at 146,000 plus, while 64,000 plus cases had recovered and about 4,222 fatalities were recorded as at Sunday, 31st May 2020. Reports have shown that there are lesser number of confirmed cases than expected across the African continent. Countries have continued to record significant daily increases capable of overwhelming our fragile healthcare systems if there is a consistent surge. This calls for caution, planning, multi-sectoral investment in institutional and human capacity, scientific and methodological approach, as well as citizens' commitment to the control of the pandemic. As at midnight on the same day, Sunday, 31st May 2020, Nigeria had recorded and passed the milestone of 1,000 confirmed cases with 10,000 milestone of 10,000 confirmed cases with 10,162 confirmed cases of COVID-19, 3,007 discharges, and 287, unfortunately, deaths. Significantly, Nigeria recorded 553 new cases on Saturday, the 30th May 2020, representing the highest single-day numbers ever. Nigeria's national response has continued to rely on science, data, experiences drawn from other nations, and consideration of our peculiar environment to address the pandemic, while observing the guidelines issued by the World Health Organization. While reviewing the impact of previous measures and the first phase of the eased lockdown, the Presidential Task Force prioritized the following aims. 1, ensuring a cohesive, exhaustive, and data-driven policy to guide the opening of the country. 2, putting in place procedures for effective review of the country's reopening policy. 3, mitigating against our health system being overwhelmed by a series of sustained outbreaks. 4, maximizing the impact of non-pharmaceutical interventions on COVID-19 control. And 5, minimizing the negative and social effects of the non-pharmaceutical interventions. Similarly, the Presidential Task Force adopted the following guiding principles to ensure that the response is robust and holistic. The first, utilization of data systems to assess risk, measure response performance, and evaluate progress. 2, application of non-pharmaceutical interventions in a measured and stepwise manner, e.g., using 2-week intervals to identify adverse effects. And 3, narrowing the focus of non-pharmaceutical interventions with significant side effects, e.g., business closures, stay-at-home orders, to targeted areas for effectiveness and impact. 4, development of systems for the protection of the vulnerable groups. And 5, prioritizing of risk communication and community engagement with emphasis on community involvement and ownership. And 6, encouraging states to fund activities such as contact tracing, sample and data collection, etc., that support the control of COVID-19, thereby generating data to aid decision-making. The Presidential Task Force, in reaching its conclusions and making recommendations for next steps of the response, remain mindful of the following important socio-economic issues. The first being impact of COVID-19 on the global economy and all national economies. 2, pain and hardship brought about and upon the poor and vulnerable, the aged, the sick, people living with disabilities, and particularly those whose survival depend on their daily earnings. And 3, impact of the closure of schools and tertiary institutions. 4, avoidable death of citizens occasioned by the decline in the level of availability of medical facilities to citizens due to closure of medical facilities, rejection of patients by hospitals, and the fear of stigmatization. And 5, the level of infection of frontline workers and its implication for the national response. From the economic development, security, and social cohesiveness of the perspectives, the Presidential Task Force also worked closely with the Economic Sustainability Committee under the chairmanship of the Vice President, the Central Bank of Nigeria promoting the development of stimulus packages for different categories of SMEs, farmers, businesses, etc., and with the Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development working to enlarge the database of some of the social intervention programs for inclusiveness and also interventions in the areas of palliatives. 4, the Federal Ministry of Labor and Employment charged with the mandate to organize the special public works intervention capable of employing 1,000 youth from each of the 774 local governments in the country. With also the Federal Ministry of Agriculture and Rural Development on the mobilization and technical support to farmers for the planting season, as well as unrestricted movement of food and other agricultural produce. With the Federal Ministry of Education for the development of guidelines and protocols for safe reopening of our schools. And with the security agencies, even this morning, for the enforcement and protection of lives and properties. We also engage with the professional bodies, civil society organizations, the labor sector, trade associations, religious and traditional rulers. Went further to interface with the Nigerian Governance Forum and the leadership and membership of the National Assembly. The Presidential Task Force has taken into consideration the advisory of the World Health Organization on the need to do the following when planning to ease a lockdown. The first being to balance lives and livelihoods, and the second, to follow a slow and phased approach that is data-driven. Third, apply public health measures in every community and at every phase of the response, i.e., surveillance, case finding, testing, isolation, tracing, and quarantining contacts. And four, evaluating the economic and social aspects of the society, which will play a role in progressing or hindering any efforts for the response. It is the consideration of the Presidential Task Force that while Nigeria's confirmed cases have increased in the period under review, the following factors should inspire confidence in the response. The first being, majority of the confirmed cases are in a handful of local governments in the country. 2, 20 out of the 774 local governments nationwide account for 60% of the cases, and there is a map attached to my speech which you would have when it is mailed out. There is an opportunity to concentrate efforts in these high burden areas. And 4, federal agencies and state governments are working together on the promotion and utilization of guidelines on case management, e.g. home care for relatively well patients. And 5, there is increased capacity to test, detect, trace those infected with the virus. As of today, we have 29 testing laboratories that have been activated, with Bauchi being the latest addition, while the test count nationwide has exceeded 60,000. And 7, there's a shift in focus to community engagement and enhanced risk communication. Notwithstanding the foregoing, the Presidential Task Force considered it necessary to reinstate or to restate to Nigerians that 1, Nigeria has not reached the peak of confirmed cases yet. 2, the battle against COVID-19 is a long-term one. 3, Nigeria should pursue a strategy that will aid the sustainable growth of the spread of the disease. 4, risk communication and community engagement should remain top priority. And 5, precision approach to containment and management should be adopted, particularly dealing with the 20 high-burden local governments. Based on the overall assessment, including available data on the public health consideration and resultant economic impacts, the Presidential Task Force is of the opinion that Nigeria is ready to allow science and data determine how cautious advancement into the second phase of the eased lockdown for a period of 4 weeks. After considering all the factors mentioned above, the Presidential Task Force submitted its recommendations, and the President has approved the following for implementation over the next 4 weeks, spanning from tomorrow, the 2nd of June, to 29th June 2020, subject to review. 1, a cautious advance into the second phase of the national response to COVID-19. 2, application of science and data to guide the targeting of areas of ongoing high transmission of COVID-19 in the country. 3, mobilization of all resources at state and local government levels to create public awareness on COVID-19 and improve compliance with non-pharmaceutical interventions within communities. 4, sustenance of key non-pharmaceutical interventions that would apply nationwide and include the following. A, ban of gatherings of more than 20 people outside of a workplace. B, relaxation of restriction on places of worship based on guidelines issued by the Presidential Task Force and protocols agreed by the state governments. C, manage access to markets and locations of economic activity to limit the risk of transmission. D, ban on interstate travels except for movement of agriculture, produce, petroleum products, manufactured goods, and essential services. E, continuous mandatory use of non-medical face masks in public places. F, mandatory provision of hand washing facilities and sanitizers in all public places. G, extensive temperature checks in public places. H, maintaining social distancing, about 2 meters between people in public places. I, strengthening infection prevention and control at healthcare facilities. J, isolation of the vulnerable population, elderly and those with underlying health conditions. And K, massive information and education campaigns. The fifth being deepening of collaboration efforts with the community leaders, civil society, faith-based organizations, traditional institutions, etc. And 6, continuous mobilization of state governments to take up greater role in the implementation of the guidelines and advisories provided by the Presidential Task Force. 7, continued provision of support by the Nigerian Center for Disease Control to states through guidelines to shape decision-making in responding to high-burden local governments and wards in the various states. And 8, easing the total lockdown of Kano State and introduction of phase 1 of the eased lockdown. Ladies and gentlemen, this is still a fight for life, and our advancement to phase 2 does not mean that COVID-19 has ended. It is still potent and highly wasteful of human lives. I therefore implore all Nigerians and corporate citizens to take responsibility and play the expected role expected of each and every one of us. I will now invite the Honorable Minister of Health to provide you with further details. The DG Center for Disease Control would elaborate on the technical aspects of the next steps, while the National Coordinator would expatiate on the guidelines before it is published. Thereafter, Honorable Ministers will give you updates on the responsibilities of their various MDAs. I want to thank you for listening.
I'm sorry, we have to apologize. We need to give priority and exclusivity to the chairman's address, and only the national coordinator will elaborate on what he has said, because this is like the second phase of the lockdown protocol, and we will not want that to be diluted by any other usual ordinary matter. We apologize, please. Thank you.
Thank you, the Chairman, PTF, Honorable Ministers and members of the Presidential Task Force, gentlemen of the press, good evening. So as stated earlier by the Chairman, the goal of Phase 2 over the next 4 weeks is to balance public safety with protecting livelihoods, as well as allowing the full restoration of economic activities across the country. Effective from tomorrow, Tuesday, the 2nd of June 2020, the easing of the lockdown will be characterized by the following. 1, the nationwide curfew will remain in place, but the timing of this will be reduced to 10 p.m. to 4 a.m. And just to clarify, the purpose of the curfew is to limit social interactions and therefore reduce the risk of transmission of the virus. Persons that are on essential duty, including but not limited to those involved in the provision of healthcare services, media services, and critical infrastructure, are exempted from the curfew. 2, all interstate travel by individuals remains prohibited except for essential travel and the movement of goods and services. Just to make it clear, all restrictions on the free movement of goods and services is now removed in this phase. 3, there will be full opening of the financial sector, with banks now allowed to operate normal working hours 5 days a week. 4, the mass gathering of more than 20 people outside of a workplace or places of worship remains prohibited. 5, there will be controlled access to markets and locations of economic activities, but local authorities will continue to provide guidance on opening times. 6, restricted opening of places of worship will be based on state government protocols and with strict guidelines on physical distancing and other non-pharmaceutical interventions. And just to clarify, this will apply to regular church and mosque services only. 7, mandatory supervised isolation of persons arriving outside the country will continue to be for 14 days until a new policy comes into place. But just to clarify again, there will be no further evacuation of Nigerians until the new policy that is currently being developed with the private sector comes into place. So, any prior arrangements for evacuation of Nigerians from outside the country is suspended until the new policy comes into place. I will now go through the specific protocols for containment of COVID-19. And just to emphasize that all these measures would need to include compliance on the non-pharmaceutical interventions. Things such as the provision of hand washing facilities, the mandatory wearing of masks, the maintenance of physical distancing, the avoidance of mass gatherings. In terms of general movement, persons may go out for work, go to buy necessary foods, and for exercise, provided they abide by the curfew hours. Movement between local government areas is strongly discouraged unless for critical reasons such as healthcare and work. I would like to emphasize that it is still safer to stay at home and avoid crowds. The pandemic is not over in this country, and the relaxation of some of the rules does not mean that it is safer to go out. If you do not need to go out, please continue to stay at home. Hawking and street trading is also prohibited, and we will be looking into this in greater detail with state authorities. For the aviation sector, the aviation industry is requested to start developing protocols to allow for domestic flights to resume anytime from the 21st of June onwards. Airlines must ensure physical distancing by reducing passenger capacity, ensure the provision of sanitizers and appropriate personal protective equipment, as well as carrying out temperature checks at point of entry and departure, and ensuring that airports are not congested by either travelers or airport staff. With interstate travel, movement across state borders remains restricted other than the free movement of goods and essential travel. Security services are requested to please cooperate with members of the public and ensure that goods are provided with free passage, as this particular phase is directed at ensuring the economy starts moving again. With intra-state travel, we will implement new travel processes for areas of the country with high burden local government areas, and this will be restricted to essential travel. But for the moment, with intrastate travel, all the prior guidelines will remain, including reduced occupancy for buses and taxis, the need for temperature checks where available, the provision of hand washing facilities, and the maintenance of physical distancing. For the industry and labor sectors, in terms of working hours, normal working hours would apply to offices other than government offices, provided this is kept within the curfew hours of 10 p.m. to 4 a.m. Offices are to maintain working at 75% capacity while maintaining the 2-meter physical distancing. For government offices, they can open between the hours of 9 a.m. to 2 p.m., so no change in opening hours, but can work from Mondays to Fridays. Prior to this, we allowed a 3-day working week. However, only persons that are within the grade levels of 14 and above at both the federal and the state government level will be allowed to come into work. We will encourage staff to continue to work at home if possible, including within the business and the private sector, making the best use of technology that is now available. For personalized services such as mechanics, artisans, hair salons that own their own workshop or workstations, Provided they clearly adhere to non-pharmaceutical interventions, they are allowed to operate from now on, but must ensure the wearing of a face mask when selling goods or providing services, must ensure provision of sanitizers and appropriate PPEs to their workers. They must limit the number of workers and customers within their premises, and state and local government authorities are requested to please ensure and monitor compliance. Supermarkets, there's no major change for supermarkets, neither is there any major change in markets, apart from the fact that local authorities will continue to define the day and time for opening of shops. Hotels may reopen, but must observe all mandatory non-pharmaceutical interventions. Restaurants other than those in hotels must remain closed for eat-ins, but are allowed to prioritize and continue practicing the take-away system. Bars, gyms, cinemas, and nightclubs are closed until further evaluation. We will continue to support the agricultural sector to ensure food security for our citizens, and in this regard, farmers are requested to please go ahead with their normal activities provided they observe all mandatory non-pharmaceutical interventions. Schools. All schools to remain closed until further evaluation. The Federal Ministry of Education is instructed to work with schools to start the process of preparing students that require exiting exams, i.e. certifying students, to allow them to take exams in the next phase, early in the next phase of the lifting of the lockdown. But for the moment, schools are to remain closed. I have already mentioned places of worship. Restricted opening will apply, subject to the guidelines issued by the PTF, as well as the protocols agreed by respective state governments working with religious leaders. We expect all mandatory non-pharmaceutical interventions to apply. Recreational parks and communal sports will remain closed until further evaluation. And for funerals, we are still limiting this to 20 people, including close family, with physical distancing to be adhered to, as well as hand washing. Finally, state governments and security agencies are enjoined to ensure effective and strict enforcement of these guidelines while respecting the exemptions that have been approved by Mr. President. Thank you.
Thank you very much. We have been presented this afternoon with details of the next steps. We are already observing an adjustment in the format we are maintaining today. So we'll take the questions from gentlemen of the press, but we advise strongly that you focus the questions on issues raised in the speech of the chairman and the elaboration done by the national coordinator. So, let's start.
Good afternoon, sir. My name is Friday Okeregbe. I'm a reporter with Channels TV. I would like to start with the Minister of Education. Now that the restriction on reopening of schools still continues, how do you intend to manage the situation of Nigerian students who are operating other academic calendar other than ours? I'm talking about international schools operating in Nigeria. We have some French schools, we have some American schools, and even some British schools that are operating in Nigeria. The academic calendar, they don't run Nigeria calendar. And these Nigerians who are in these schools are already a semester, almost a semester ahead of their counterparts in where these schools are actually domiciled. So how do we manage the situation? Are we going to allow our children to just lose a semester like that behind others, or you have a particular recommendation for them? My second question, I would like the Minister of Health to respond to it. During the weekend, the resident doctors issued a 14-day ultimatum. And some of the reasons why they issued that ultimatum has to do with the lack of PPEs in some of the hospitals where they work. Also, they talked about the non-implementation of the special hazard allowance for those who are in the forefront of COVID-19. How are you managing the situation, especially knowing how, if they go on strike, how it can actually impact negatively on the fight? And lastly, the Minister of Interior, please, I'd like you to also respond to this. Over the weekend, there is a report that the Chinese medical team have been smuggled out of the country. What is the update, please? Thank you.
Gentlemen of the press, please, questions should be restricted only and only to the address of the chairman and the elaboration made by the national coordinator, because it is very important that the public knows precisely what the second phase is. They want to know, are schools closed or not? They want to know what is the situation about interstate restriction. They want to know what's about curfew. Please, for today, all other questions should be stepped down. Please concentrate solely on the address of the chairman and the elaboration made by the national coordinator. Thank you very much. So we will ignore all questions that are not relevant to this. Thank you very much.
Good afternoon, the chairman, members of the PTF, my colleagues. My question is to the national coordinator. So with the schools remaining closed, the Admiral School of Navy in Delta State has started their exams. They have to start today. We would like to know, are they not part of the rules? Then you said the airlines are to reopen on the 21st of June. And then this new second phase guidelines is to end on the 29th. So does that mean there will be interstate travel, or are the airlines just to take passengers outside? And does that also mean our borders are now open? Thank you.
Good evening, members of the PTF. My name is Juliana Taiwo Baloyen of the Sun newspapers. National Coordinator, I would like to know, you said hotels can now open, but interstate travel remains banned. I'd like to understand the rationale behind that. Thank you.
Good afternoon, members of the PTF. My name is Yemi Adebayo from AIT. The PTF chairman, sir, I just want to find out from you, sir, the issue on the relaxation of restrictions placed on worship centers. Clearly, there are guidelines the NCDC has put out for these worship centers to follow. What is the implementation plan going to look like? Is the PTF going to set up a team that will monitor some of these worship centers to actually see whether or not they align themselves with the various measures and the guidelines put in place? Thank you, sir.
Good afternoon, Chairman and members of the Presidential Task Force and Nigerians at home. My name is Mitaire Ikwe and I report for the Nigerian Television Authority. I want to ask the chairman or the coordinator of the Presidential Task Force, what is the essence of the interstate travel ban if domestic flights will resume on the 21st?
And secondly, I want to ask precisely what are the PTF protocols that will guide the reopening of worship centers? Thank you.
Good afternoon, sirs. My name is Felix Onua. My question, I'm from Reuters. My question is for the coordinator. You just mentioned that June 21st, domestic flights may resume. I want to know if when the international flight is likely going to resume.
We have taken questions for the first phase. It would appear our colleagues are still digesting the address of the chairman. So we will encourage them to look deeper into what has been circulated electronically and generate further questions. For now, we have questions directed at the Honorable Minister of Health, the National Coordinator, the Chairman, the Honorable Minister of State Education, and the Aviation, okay. Honorable Minister Aviation. So we'll take them in this order. Honorable Minister of Health, the National Coordinator, Honorable Minister Aviation, Honorable Minister of State Education, and the Chairman. So we'll begin with the Minister of Health.
Good afternoon, everybody. The question I have is just one about the threat of the resident doctors to go on strike. As we speak, the negotiation is going on with the Minister of Labor. The Permanent Secretary of the Ministry of Health is there representing us. And many of the points raised by resident doctors are points that have easy solutions that can be solved. Some of them are actually from way back, they're not new. But the ones regarding personal protective equipment, yes, that has been actually also addressed. PPEs are being supplied and as requested and as needed. So they're keeping a very good eye on the inventory and supply chain. There was a time in the past when we had some small constraints, but we have actually gone past that level now, and there are plans to continue to increase the stockpile of PPEs that we have. So I also use the opportunity to speak to the resident doctors and urge them not to carry out that threat at this time. Everything is being done to make sure that all the questions are answered. And I also want to say that if they have any kind of grudges of that nature in future, they should use the avenues of communication. My office is always open, and they can call me up or write to me to discuss these issues at the ministerial level before it gets to the public level, to use all avenues of collaboration. All of us are members of the NMA, and we too were once resident doctors, so we understand your position, and we're able to make sure we see to your needs. Thank you.
Honorable Minister of Aviation.
Good afternoon, gentlemen of the press. Well, so regarding the tentative date for opening up of domestic flights from the 21st of June, the explanation is that this is an industry that is highly regulated, borders on safety and efficiency. So we have looked at all the things that we need to do to be able to open. They are broadly divided into two broad classifications. The first is that there is a technical aspect of it, and then there is a health side of it. On the technical aspect, there are the aircraft themselves that have been parked for about 3 months, not being run. We have to ensure that within now and that time, these airplanes are good and safe to fly. The maintenance for aircraft is either usage or calendar time, whichever comes first. And there are protocols to storages of such craft, either for short term, for long term, or forever. That is being done currently, so the airline industry needs to be able to bring those machines to safe operations. There are issues that are affecting also the flight crews and the cabin crews. Like I said, they are highly regulated. They are all licensed to carry out their functions. This license may fall due for recurrency to get them back to currency, and that is extremely very important for safe operations. Within the period, we are developing the house to get them to be able to come and get their license valid for this, for the operations. There are also the issues of medicals, that every pilot has a medical license or medical permit that states that he's physically fit and well enough to carry out safe operations. Within this period, some of them will fall short and they need to do their medicals, and so on and so forth. And then, of course, even the operations, the airports where these activities will be done. I listened to the very simplistic arguments, not on this forum, at another forum, saying that airports are just mere shopping malls. That is very simplistic, not backed by any knowledge. For me, an airport is that amoebic, borderless space where economic activity gets done that includes air transportation, among others. Amoebic because there's no form and shape, borderless because one long mile runway leads to everywhere. 1 mile long road leads to nowhere. You can take off from Azare or Akure and fly to China, and it can cause havoc from where you are, from that little space. So it's an open border, and it's highly regulated, and it is international, and it is one aviation. There is no aviation B. So all the standards and recommended practices are the same, and we have to conform to those international standards and regulatory practices. On the health side, there is how the passenger will ensure that he has wearing a mask, perhaps a face shield, physical distancing, clean surfaces, getting the airports back to accept this new culture, new way, new system of travel all over again. You will agree with me that it's huge. We didn't sit idle after closing the airport to say, okay, well, until when they announce a new date will start. No, we have been gradually engaging the stakeholders. We've created various social media platforms. We've created avenues through Zoom, through Adobe Connect, and so on and so forth, talking to the industry on a daily basis and getting them ready to be able to take this new challenge. Indeed, we are the worst hit, and we're eager to start. We would love to start yesterday, but we must start in a very orderly, organized, safe, efficient manner so that we will achieve the intent and purpose of air travel, which is safety, efficiency, and in a very secured manner. So please kindly bear with us. We want to start more than you want to start. I've said here that because it's a service industry, if I don't sell ticket today and you don't fly, I have lost it. It's not like selling a mobile phone, which I can keep in my shop. Whenever the market opens, I sell them. I still make the same profit. But this one, this 3 months, we've lost people flying, and which means that salaries cannot even be paid because no income is being made because it's service nature. So please bear with us. The question to the international will follow today, before the end of today, we will be receiving directives or suggestions or practices and standards from ICAO, International Civil Aviation Organization. We'll factor that in. Currently, I'm the chairman of the Logistics and Transport Committee of the West African Ministers to advise Mr. President, who is the champion of the COVID-19 within West Africa. Today, we held a meeting on how the industry will be started up all over again. Some countries definitely will run faster than others. But I can tell you that huge countries with huge population and huge aviation activity, such as Nigeria, will definitely need caution. We need us to reflect on safety and efficiency of the industry. 200 million people on 923,766 square kilometers. It's really enormous and calls for every single action that will ensure safe operations. Then the private jets wanting us to short-circuit the system by which we are given approvals for flights. Certainly, it is not for anybody who has money to fly on the private jet from Kano to Lagos or Port Harcourt. No. We still maintain and insist that it must be either for health reasons, for humanitarian, banking and finance, oil and gas, power, and agriculture. These are the ones that will allow to fly even on private jets. It's not just any individual. You've seen what happened with the flare jet the other time. So even within the country, we only allow for those. And the approval is electronically done. Just send a WhatsApp and we'll respond. And from the four of us, you will get one. Myself, the Permanent Secretary, the Director of Air Transport Management, and the DG NCA. As a matter of fact, you can also send to the Managing Director of NAMA, Nigerian Airspace Management Agency. And it's electronic. One of the five of us will see your request and it will be tended to within minutes. And I must say here, finally, that I have heard or read also on Twitter that there are certain monies being charged for approval for flights. This is far from the truth. This is far from the truth. It's so free. It's just approval. It's just a pen, say approved. Or it's just a text message, send them back to approve. So nobody should con anybody. And the people should stop living in the past. For us, in this government, we are very conscious of the weight of responsibility on our heads. I've been minister 5 years now, and I challenge anybody before all of these cameras, there's not a single aviation business man or woman owning airplane or owning airline or doing any kind of business, catering, taxi, hotel, whatever it is, any business whatsoever within the aviation industry, or any permanent secretary, director, or any civil servant, or any public servant, or whatsoever that has given me, or I ask, or he offered, or I take any money. And I challenge anybody today. There is the Freedom of Information Act in place. We will give you all of the information, all of the documents that you require. It has happened before. I threw this challenge, if you remember last year, during stakeholder meeting, and only one person came up, and we gave him all of the documentation he required. And he came back to apologize in public with over 1,000 people in President Joe, the stakeholder. So we really mean business. People should stop living in the past. You don't need to pay for any service under this government, under President Muhammadu Buhari. You have a good day.
Well, good evening, everybody. The question actually relates to the school, the Navy school, and those who are running different programs. The programs, whether they are a French curriculum or an international curriculum, are not necessarily ours to regulate at the moment. We can't stop or move everybody back to school because French people are back in school or that they are running a program. If you listened to the words of the chairman of the PTF. We have taken these decisions to protect Nigerian lives. I sincerely understand how parents and proprietors and all the stakeholders in the education sector do feel. Maybe the national coordinator may have used wrong word when he said instructed. We don't instruct. We actually are collaborating with all of you, and we plead that you understand what it is that we are doing. We want to have as much input from parents and stakeholders as much as we run the ministry. There is nothing we are doing from this point that is punitive in any way. We've only made recommendations and aligned them with the workings of the experts, the WHO, the Center for Disease Control, and those from the Ministry of Health. Once the schools are safe for our children to return to, I will be more than willing to quickly get the ecosystem working again. But that does not limit people from learning. In my last address, I had said anybody who finds some sort of online service, online courses, I've encouraged my children to do the same. I've encouraged my wife and people around me to do the same. I will encourage you to do so. Whilst you're home, whilst you're not engaged, it may be nice to take on a new vocation, a new course, something that actually just makes your life better or makes you even a better person for our education sector. I'm aligning myself with what the Executive Secretary of the NUC is doing. He's also talking to lecturers in all of our universities to use the opportunity to upgrade themselves in the courses that they teach and how they teach it. And even when we return to physical classes, it might be important that even some of the courses that we may then project online, that our lecturers are able to deliver them better. So this is also a learning experience for everybody. So the disparity that exists between different college systems will not stampede us into taking decisions that are not fervent for our people. And that's the same thing I will advise in respect of the military school or the Navy school in Delta. If indeed the Navy is running such a program, they must be encouraged. It is not against us. But it's still within the ambit of what is available there. Is it possible for students to go? When you say go to school, we're not just talking about children get into a classroom and go home. That means the entire transport sector needs to be open. We have to have a way of getting our teachers even to class. We want to be sure that teachers can take their books home and mark it, believing that they are not taking COVID home to their own children. There's a lot. Teachers want to know if somebody comes to school and his temperature or her temperature is high, what will happen? If she or he loses class time, what will happen? There are a lot of questions around this. So we can't take one item off the shelf and suddenly decide that maybe go get it just because we say we can. So really, this is a coordinated effort. I am really apologizing to the rest of my Nigerian brothers and sisters that really we had wanted and would love to open schools as soon as we can. But this is the 1st of June, and the numbers from the experts are not telling us to do so. As soon as they tell us to do so, we will gladly open. Thank you very much.
The national coordinator.
Thank you. So just to clarify, so first of all, what I wanted to say really is what the PTF is doing from now on is to provide a nationwide set of minimum safety guidelines that states can build on to strengthen their local strategies on prevention of COVID. So when we say protocols for religious places of worship, those protocols will be the bare minimum that we would expect. What are the things that will put you at increased risk of catching COVID? It's how close you are to a person. It's for how long you are within the same place with a person, so the duration of stay. It's whether or not you are protected in terms of your mucosal surfaces. It's whether or not your hands are contaminated or surfaces are contaminated. So when it comes to religious places of worship, that's why we're saying restricted opening, subject to the guidelines issued by us when it comes to non-pharmaceutical interventions, but also working on agreed protocols that have been worked on between state governments and religious authorities. We are not opening places of worship across the board. We're saying that opening is conditional and it is based on these clear-cut guidelines and would only cover regular church and mosque services. So we have to reduce the duration of exposure for persons. We have to make sure there's physical distancing. We have to make sure that everybody wears masks. We have to make sure that you sanitize your hands. We have to make sure that the environment is cleaned and cleaned and cleaned continuously. But more importantly, we also have to make sure that we protect the vulnerable parts of our population. The elderly, those above the age of 60, 65 onwards. When we look at the death rates, the mortality in Nigeria to COVID, half of those that have died are above the age of 50. The case fatality rate is 18% in those above the age of 60, which means if you catch COVID today in Nigeria, you're above the age of 60, you have an almost 1 in 5 chance of dying. If I ask you to cross a street and I tell you you have a 20% chance of dying, will you cross the street? So clearly, whatever we do in terms of guidelines and protocols, we are providing a minimum set of guidelines that we would expect state governments, we would expect communities, we would expect civil society, we would expect traditional and religious authorities to support us on this, because it's all about saving lives. The Honorable Minister of State Education has spoken about Delta State University, so I won't say any more. The Honorable Minister of Aviation has talked about airlines, and just to clarify, when we say from the 21st of June, we mean that we are preparing the aviation sector towards that date. But that date may not necessarily be the 21st of June. It could be the 26th, it could be the 28th of June, it could be the 1st of July. It depends on whether or not they are prepared. So we're giving them a time frame of 3 weeks to start preparing for domestic flights. Once we open up the skies to domestic flight, we will have to review the arrangements with regards to interstate travel. Because of course the two will not be, you cannot have a ban on interstate travel and meanwhile you have people flying from one state to the other. But we are giving an opportunity for the aviation sector that's heavily regulated to make sure that they start getting their acts together so that our airports open up in a safe way. The other issue has to do with hotels. Why are we opening hotels and restricting interstate travel? Well, you will recall that we said we are removing all interstate restrictions when it comes to the movement of goods. Goods do not transport themselves. They are transported by humans. So as part of opening up the economy, there are certain sectors of the economy that are important. And this includes the banking sector, which is why we removed all restrictions in the banking sector. With hotels, we never really closed them, but we've had a lot of queries in the first phase as to whether or not they are allowed to operate, which is why we are making it very clear in this particular phase that hotels can open, but with the normal non-pharmaceutical interventions applied. And when it comes to restaurants, you cannot have a hotel without food. So that's why we're saying restaurants are closed except those that are within hotel setups. And we expect those within hotel setups to only serve the guests within those hotels. But goods cannot move on their own. They have to be moved by human beings. Well, at least in this country. Maybe later on we might have robots or automated vehicles. I think I have addressed most of the issues. Thank you.
Thank you. Although we have questions directed at the chairman, we will step his coming to the podium at this moment. We'll step it down. We will go straight into the second wave of questions. As I suspected, our colleagues have digested, and 6 indications have come up that there are questions for the second wave. So we'll take the questions now. Then we will invite every other person to the podium before the chairman rounds it up.
Good evening, Chairman, PTF, Honorable Ministers, DG, my colleagues. My name is Femi Akonde. I'm a reporter with TVC News. As clearly, from all indications, the Presidential Task Force would like to shed some of the load in the National Response Plan to state governments to handle. And we're hearing reports that some state governments at the moment are jittery about over this move. Not all of them have that capacity to respond properly, just as the Presidential Task Force is doing. My question is, in what way would you support the state government in responding to the COVID-19, apart from providing guidelines? What other kind of support would you be giving them? Would there be also deployment of medical equipment to some of these states whose health infrastructure may not be able to cope with the impact of handling COVID-19 cases? Thank you.
Good afternoon, everybody. Rachel Abuja from the News Agency of Nigeria. My question is for the PTF team. I would like to know if we are prepared for a second wave of transmission to start with. And we all know what's playing out there. We've seen South Korea. In fact, they were in the fourth run. They went back to school. At the end of the day, they are back home. And secondly, with the increase of sudden reports for COVID-19 cases in Nigeria now, we have 553 just 2 days or 3 days ago, and yet we are easing our lockdown. So I want to know what's in place. And the other day, the coordinator is not even sure of how many PPEs we have. He does not have them in record. So while we ease the lockdown, let's know what we have in place to curtail the next wave. My next question is for the Minister of Aviation. We'll be going back, as in we'll be making use of our airport, you said on the 21. Will that not stop other travel bans, let's say for interstate travel bans in the country? Because we are looking at 4 weeks, and now we'll be opening on the 21st. So let's know how you will be able to manage this. Many thanks.
The chairman, members of the PTF, my colleagues. My name is Amaka Ude. I report for Arise News. And my first question actually goes to the national coordinator. So earlier you spoke about small businesses opening, but you only called out salons. So I want to know, for those who have shops in plazas, it could be an electronics store, a phone shop, are they allowed to open now? We need clarification on that. And the next question is actually, these are questions that came in for the Minister of Aviation, just as the broadcast was going on. This one says, are the airlines going to reduce passenger intakes and insist on wearing a face mask for passengers? And the second question is it possible for the PTF to control the hike in airfares, since reduction in passenger numbers will mean reduction in revenue, but not reduction in operating cost? Thank you.
Good evening, Mr. Chairman, members of the PTF, my colleagues. My name is Mohammed Salih Nazif. I work for Voice of Nigeria. My question goes to the coordinator. Right from the beginning of lockdown, coming down to the easing of the lockdown, and now we are heading towards the second phase. Guidelines, warnings, and so many other protocols has been dished out. But in terms of interstate traveling, there is a little adherence to that area. As we are talking now, people are still traveling. I know the PTF meant well. Anytime we came here, you try to address this issue and call the attention of the Nigerians to stop traveling. But as of now, most of the states have eased their lockdown, as if they are not monitoring some of these traveling that is taking place from one state to another and coming to Abuja. Federal highways belongs to the federal government, and we have security personnel manning those highways. But still, people are still traveling. Who is manning the police? Who is checkmating the police in particular? Because most time in the night, people travel. And it's one of the areas where we see the the increase in the numbers we are having today. Thank you.
Good afternoon, sir. My name is Musa Aminu from Voice of Nigeria. Tambaya ta da harshen Hausa ne. Ina so mai girma ministan sufuri da ke kula da sufurin jiragen sama na Najeriya ko kuma shugaban wannan kwamiti wato SGF kenan, ima al'umma musamman masu saurare da kallo da sashen Hausa bayani musamman akan abin da ya shafi wannan zirga-zirga tsakanin jihohi. Saboda idan aka yi bayani da harshen Hausa yana ilmantar da al'umma sosai kwarai matuka. Na gode.
Good afternoon, sir. SGF, honorable ministers, and my colleagues. My name is Abiodun Oloyede Popola. Actually, I would like to ask in Yoruba and also in English. But I want to quickly ask this question, because when I was going through the SGF remarks, I was like, data and science in Nigeria. I remember some weeks ago, I asked this question, that in Nigeria, when we're talking about data, do we really have the data? And if we are going to make use of this data, how possible will it be so effective? I really appreciate the effort of the SGF, but at the same time, there are some things we need to look at so that all this effort will be achieved. Then also in Yoruba, sir, I will appreciate my honorable Minister of Information and Culture. I would like you to answer this question also in Yoruba, and also the second one I'm about to ask. The first question is about pé wọ́n ní a fẹ́ lo ìmọ̀ sáyẹ́ǹsì àti àwọn ohun èlò tá a ti nílẹ̀ bóyá òǹkà tàbí nǹkan mìíràn. Ipò tá a wà lórílẹ̀‐èdè Nàìjíríà báyìí, ǹjẹ́ a lè sọ pé a ní òǹkà tó jẹ́ pé a lè gbára lé láti ṣàṣeyọrí nínú nǹkan tá a fẹ́ lò yìí. Then eléèkejì tí mo fẹ́ kẹ́ bá wa ṣe ni pé àwọn ìlànà ètò tí wọ́n là kalẹ̀ yìí, mo fẹ́ kẹ́ bá wa tú ní èdè Yorùbá fún àǹfààní àwọn èèyàn wa tó wà nílé kí ó lè yé wọn yékéyéké. Thank you very much, sir.
Thank you. We have taken the second wave of questions. There's a question joining the Minister of Health, the DG, NCDC, and the National Coordinator. I'd like to find out. I would like to assign that question to the Honorable Minister of Health, but he can delegate it to any of the other two. That's on the preparation for the second wave. There's a question to the National Coordinator, specifically. Then we have questions for the Honorable Minister of Aviation, Honorable Minister of Information and Culture, and then the SGF. The SGF will come last to wrap it up, along with the questions from the first wave of questions that we had. So we begin with the Honorable Minister of Health.
Okay, thank you. See, the questions I see relating to the Ministry of Health has to do first with supporting states in the health sector, and someone who says some states are jittery. Well, it is one response, as we have said, one national response, and the fact that we have 36 states and Federal Capital Territory should not mean that we have different responses. It's one, and that response is implemented at federal, state, local government, ward, and community level. There are responsibilities that are delegated to the community, where we engage, perhaps more than any other ministry, with community leaders, traditional leaders, religious leaders, in trying to make some health-related issues clear and to reach down to the grassroots. So in this particular phase of COVID-19, it's essentially a health issue. And the emphasis I have made many times is that there are aspects that the government will be involved in, there are aspects that the states will be involved in, and particularly aspects where community leaders, the citizens, will have to take ownership of and drive. We have used the example of wearing masks, for example. It protects each individual if there's a dual purpose, two people are together and both are wearing masks, generally they protect themselves. If you go into the market, to a public, and to areas where you are likely to encounter people who are not necessarily able to observe social distancing, your mask protects you. So the messaging that goes along is a messaging that is expected to be driven across the board. The policy comes in from the federal government and also in consultation with the states. That's why we hold National Council on Health. And then also the states involve these local governments, and then right down to the community level. So it's extremely important. Now, you have also heard us say that we send missions to states. I was going to say today that right now as we speak, the mission from the Federal Ministry of Health has arrived in Lagos, made up of, led by the Executive Director of National Primary Healthcare Development Agency, but comprising representatives from the Department of Hospital Services, Department of Public Health, Department of Family Health, and NCDC. They're all going to see how Lagos is doing. Lagos has those peculiar challenges, and find out ways in which federal government can offer support and also offer some suggestions, and also share experiences, learn one or two things that Lagos is doing that can be replicated in other areas. Before now, we had spoken of similar missions to Kano, where teams from the federal government, from the Federal Ministry of Health, also from other hospitals, in fact. I've mentioned here that there are teams from IRWA that have been supporting many of the other hospitals and states, and teams from Lagos have also gone to support Kano. So there's a lot of mutual support that is going on within the Ministry of Health. And the same goes for supply of equipment. You have heard NCDC mention how many laboratories they have supported or opened to try and diversify the access to testing opportunities. In fact, we are prioritizing Federal Medical Center, Lokoja, and also the University of Calabar Teaching Hospital for the gene expert machine testing. Once the test kits are validated, the test kits in the country will need to be validated and by the Medical Laboratory Science Council, and they will start operating. Those places will be prioritized to begin their own testing and their service delivery. So as for the second wave, yes, I believe many of us will probably speak on this. The experience in many areas is that once you have a lockdown relaxed, there's a new wave that comes up, which they call the second wave. Sometimes it's very frightening, and some countries quickly reapply their lockdowns or their regulations. Here, we are aware of that and anticipating that if anything like that happens, we need to be able to counter with measures. That is why we have emphasized the non-pharmaceutical interventions, emphasized that there is a contribution that has to come from the populace, and that is not only driven by government, it's driven by everybody, every citizen. So if we practice these non-pharmaceutical interventions, stay home, particularly those who are vulnerable, spend more time at home. You are safest in your home. Wear your mask once you leave your house, particularly if you are going to an area where you cannot control how many people will be around you. And even if you live in a house or in a home that has very many people and you are not sure of their status, you can also still keep your mask on at home. If you are not sure of the status, you live in a crowded environment, yes, you are safer with your mask on. So with all these pharmaceutical, non-pharmaceutical measures, we do hope that we can temper the second wave if there's one. We'll continue to monitor, continue the risk communication and community engagement to keep everybody on their toes. That if we do play our own part, we can help in reducing, or in fact probably eliminating that second wave. But it depends on all of us. It's not all on government. That's what I think concerns the Ministry of Health there.
National Coordinator.
Thank you. So just to answer quickly the question about PPE, how much PPE do we have in country? Obviously, this is a dynamic situation. It keeps on changing. But in total, as at last week, we had 44,000 coveralls, 27,000 protective gowns, 16,000 goggles, 26,000 face shields, 4.7 million pairs of gloves, and 220,000 N95 masks. We have the full quantification of PPE required for the country for the 3-month and 6-month period. And we are currently working with our partners and government to see how we can make sure that every facility within the country has some PPE to protect itself and the staff. So I'll just go straight to the questions. Small businesses, are they allowed to open? Yes, so we are encouraging the opening of the informal sector, parts of the informal sector, and we'll provide additional guidance on this. The key thing really is that they have to function at the same level as those of the supermarkets in terms of providing temperature monitoring, in terms of hand sanitizers, distancing rules, avoiding crowds, etc. And most of the monitoring we expect will be done by the state governments. I believe there was a question about state governments being jittery. The Honorable Minister of Health has answered most of this, but how do we intend to support them? So the PTF will not shirk its responsibilities. We'll continue to work closely with state governments. We are already providing them with support in terms of rapid response teams. DG and CDC may correct me, but I believe there are at least 100 rapid response teams, if not more, across the country supporting various state emergency operation centers. We will also continue to support the state governments when it comes to the provision of testing and the quality assurance associated with it in terms of providing test kits. We will also continue to support them in terms of PPE, although we expect state governments to start taking up more and more responsibility for this. In terms of data, there was a question about data and how are we using the evidence. Actually, a lot of the decisions we take around this revolve around science, it revolves around evidence-based, and it revolves around the data we're generating. I'm sure you see the CITREP reports that come out of NCDC on a daily basis. This is a huge amount of work. The SOMAS data is what we use to influence our modeling. We have a large team of academics, people from both within and outside the country that are helping us with modeling, and we ask them questions such as, what will be the impact of the pandemic if we open interstate movement, for example? Simple question. What will be the impact of the pandemic if we continue to restrict movement in terms of a complete lockdown versus precision lockdowns? How would it affect the pandemic? So a lot of the decisions we take are not just taken off the cuff. So for example, the decision on school closures was not taken lightly at all. We looked at the science, we looked at the data, we looked at the modeling before taking this decision. But the last thing we want is for this to impact on the next academic year. And that's why we're asking the Federal Ministry of Education to start working right now with schools, to start preparing the schools to see how they can get final year students to sit their exams so that they can move on and we can create space for those that need to come in. Because COVID is not going to be with us forever. It will move on, but we don't want it to move on and then we are left with a difficult situation in terms of our school children moving on. Guidelines, warnings, compliance, restrictions. Well, we had a meeting with the security chiefs today, and one of the things that was asked, which I think will be very useful, is that the IG has specifically asked for a written letter that will indicate clearly where the restrictions are, where the exemptions are. And they will share it across the board with the entire police force so that there will be clarity. But what we did say earlier on is where there are exemptions, those exemptions shall be respected, regardless of whether we are in a curfew period or not. And we hope the difficulties that people have had with previous restrictions will not continue to arise. I think I've answered most of the questions. Thank you. Can you shout out because I can't hear you? Or use the microphone. Okay.
Are you saying that the investment you just mentioned is enough for us to prepare for a second wave? That's my question is, do we have what it takes to prepare for a second wave? And you just mentioned some investment. So is that what we'll be using?
We are not even out of a first wave yet. Who said we are having a second wave? Well, you have to prepare for the first wave. We are still within a first wave. We are still within the exponential phase of the pandemic. To talk about a second wave, you have to be on a downward curve. Rachel, we are not even on a downward curve yet, which is why we keep on saying to the public that this thing is not over yet. There are countries that have, you can only talk about a second wave if you've already had the first wave. We haven't even reached the peak yet. So we're actually jumping the gun here. Let's make sure that we deal with the first wave and deal with it properly and save lives, and those that are most likely to have severe illness are protected. And then we can deal with the second wave if it does come, but hopefully it will not. Okay, thank you.
Honorable Minister of Aviation.
Well, so regarding the modality of operations by airlines, the passenger numbers will certainly drop, maybe because we would block the middle seat and so on and so forth. And then the load factor will drop. Perhaps only 30% or 50% of the passengers will be taken. These are some of the things that we'll be looking at and how best can we take advantage and give the service. So, and then the follow-up question is to, certainly there is revenue loss. Of course there is revenue loss. And how will it affect the fare, airfare? Are we going to adjust the airfare upwards or downwards? Certainly the airfare will be appropriate to the conditions, to the issues at hand, for sure. All of this, we've been interacting with the industry players, and we've been trying to come up with the solutions in such a way the service can continue to be provided so that the economy will continue to grow. I'm sure you note the centrality of civil aviation in economic activities and GDP effects. 21st of June has already been explained by the national coordinator, so I don't think I would have to go to that. Then the issue of data, I think perhaps you may say that you are not maximizing the issue of data. But for us in civil aviation, we understand there is a full complement, a full office, National Bureau for Statistics, in charge of our data collectively. I know in my industry how many landings and taking offs are there per given period. I know the number of passengers that we have. I dish them all the time. I know how many people have gone to fly into Port Harcourt, for example, and so on and so forth. Even radio calls, all of the things that happened within the industry, we keep those data, and we're very jealous, and we protect them. And we use them when they need to use them. And we're applying them even currently in trying to establish national carrier, the aviation university, and the entire roadmap of civil aviation. So there are data there really out there. Then the other one that I really may have to cede to the chairman is this question in Hausa. Magana zirga-zirga tsakanin jihohi. To na farko dai kanin shi bayani tunda shine cibiyar gwamnati. A gane yadda wato tarayya take, ita tarayya. Bamban da jamhuriya misali, yadda aka saba yin wato mulkin jamhuriya. Sai a yi magana akan wato gwamnatin tarayya. Akwai a tarayyance, to akwai jihohi da suka haɗu suka yi wannan tarayya. Kowanne kuma akwai hurumin shi a doka. Akwai hurumin gwamnatin tarayya, akwai hurumin gwamnatin jihohi. Shi gwamnan jiha yana da ikon yin dokar da ta shahi al'ummar shi da waɗanda suka bakunce shi. Wato kenan a cikin ƙasar shi. Amma akwai abubuwan da bai iya yi saboda bai da hurumi. Misali ba zai iya tara hanya ba, babba hanya ta tarayya. Ba zai iya ba. Ba shi da wannan hurumin kwata-kwata bisa doka, bisa tsari, bisa kundin tsarin mulkin Najeriya. Kuma tilas ne kuma haƙƙin shi ne ya duk abin da zai iya kare al'ummar shi daga samun ko annoba ko cuta ko wasu bala'o'i daban-daban. Shi yasa yake gwamnati. Shi yasa in an samu kuɗin tarayya na ƙasa an sa asusu ake rabawa su ɗauki nasu, mu a tarayyance a gwamnatin tarayya ta sama mu ɗauki namu, sannan ƙananan hukumomi ma su ja nasu. To dukkaninsu hukumomi ne, amma kowa yana da hurumi inda ka samu shi. Saboda haka zirga-zirga tsakanin jiha da jiha yadda aka ba da umarni a yi haka za a bi ko dole, domin bisa ga doka da tsari ake yi kan kundin tsarin mulki. Amma gane akwai bambanci tsakanin jamhuriya da kuma wato mulukiya da kuma gwamnatin tarayya. Thank you very much indeed.
Honorable Minister, Information and Culture.
Alága àti gbogbo ilé kú jókòó. Mo rò pé ìbéèrè méjì tàbí iṣẹ́ méjì lẹ fún mi. Àkọ́kọ́ ni pé kí n ṣe àlàyé pé a sọ wípé òǹkà àti ìmọ̀ ìjìnlẹ̀ ni ó ń tọ́ gbogbo ń tá wà ń ṣe. Ẹ wá béèrè yìí pé ǹjẹ́ a tẹ̀ ní òǹkà rárá tàbá ní ìmọ̀ ìjìnlẹ̀. Inú mi dùn pé gbogbo àwọn ẹlẹgbẹ́ mi wọ́n ti ṣe àlàyé fún yín pé a ní òǹkà o. Ojoojúmọ́ là ń wá síbí, a sì ń sọ fún yín pé tó ní mọ́júmọ́ àná o, iye àwọn báyìí ni a ti ṣe àyẹ̀wò fún tí wọ́n sì ti ní àrùn COVID. Àwọn báyìí ni wọ́n ti yè tí wọ́n ti lọ́lé. Tẹ́ bá tún wá sí ọ̀dọ̀ wa, a tún sọ fún yín àwọn tó jọkùnrin nínú àwọn tí wọ́n ní àrùn yìí, àwọn tó jóbìnrin nínú wọn. Kódà a tún sọ fún yín pé tó àwọn tí wọ́n ní àrùn yìí o, iye báyìí ni àwọn tí wọ́n jẹ́ ọmọ 30 ọdún sí 20 ọdún. Iye báyìí ni àwọn tó jẹ́ ọmọ 30 ọdún sí 40. Iye báyìí ló jẹ́ àwọn tó jẹ́ ọmọ 50 sí 60. Ṣé àwọn kan ṣe àlàyé fún yín lẹ́ẹ̀kan wípé lóyìnbó wípé àwọn tó bá dàgbà jù ló yẹ kó máa sá fún àrùn yìí, nítorí pé bí èèyàn bá ṣe ń dàgbà sí ni àwọn nǹkan míì máa ti tòrò mọ́ ọ̀rọ̀ ìlera ẹ̀. A sì sọ fún yín pé nínú tí èèyàn 5 àgbàlagbà tó bá ní COVID, àti má jẹ́ kí pé ìkan inú wọn lọ sí ọ̀run. Èsì ni. So a ní alóǹkà. Ìmọ̀ ìjìnlẹ̀ gbogbo tá à ń ṣe yìí ìmọ̀ ìjìnlẹ̀ náà ni. Kódà èyí tá à ń sọ lọ́wọ́lọ́wọ́ báyìí wípé ẹ jẹ́ ká ṣì kíní díẹ̀, ẹ jẹ́ ká dẹ̀ díẹ̀, ẹ jẹ́ ká fà díẹ̀. Ìmọ̀ ìjìnlẹ̀ náà ni. Tàbí sọ wípé tó ẹ wá o, tá a bá ní kí gbogbo ká sí iléèwé àwọn ọmọdé wọ́n máa ṣe erépá, wọ́n lè máa gbá bọ́ọ̀lù nǹkankan. Tán bá délé gan àwọn tolúkọ́njọ́ ọmọdé kíní lè má dà wọ́n láàmú. Wọ́n bá délé wọ́n lè kó ran àwọn òbí wọn. Ìmọ̀ ìjìnlẹ̀ náà la fi mọ̀ wípé ó ṣeé ṣe kí èèyàn kó ní àrùn COVID-19 kó sì má mọ̀, yóò máa jẹun dáadáa, yóò máa sùn dáadáa, kódà yóò máa mí dáadáa. Ṣùgbọ́n bó ṣe wà yẹn ó ti ń kó àrùn yẹn, ó ti ń kó ran ẹlòmíì. Ìyẹn ló já sí pé ọ̀pọ̀lọpọ̀ wọ́n á sọ pé wọ́n láwọn ní àrùn COVID-19 nǹkan kan ṣe àwọn lè fò sókè. Ìmọ̀ ìjìnlẹ̀ ló jẹ́ ká mọ̀ wípé ó ṣeé ṣe kéèyàn kí COVID-19 kó sì máa mà, ṣùgbọ́n ó léwu fún aráàlú nítorí pé ó lè kó ran àwọn tó pọ̀. Iṣẹ́ kejì tẹ́ fún mi, iṣẹ́ ńlá orin kéwú ni o. Ẹni kí n túmọ̀ ní Yorùbá gbogbo àrọ́wá tí alága àti coordinator tí wọ́n sọ nípa báwo ni ètò tí a máa bẹ̀rẹ̀ láti ọ̀la. Ní ṣókí màá ṣe àlàyé. Láti ọ̀la ní ètò tuntun àti òfin tuntun lórí COVID-19 ló máa gbalẹ̀. Àkọ́kọ́ láti ọ̀la ó di dandan fún gbogbo wa tá a bá ń jáde sí gbangba, à ń lọ sọ́jà ni, à ń lọ sóde ni, a gbọ́dọ̀ fi nǹkan bomú wa o. Láti ọ̀la lọ ẹni tí wọ́n bá mú tí ò bá fi nǹkan bomú ó dá sẹ́ríà fún. Lé àti ọ̀la a gba gbogbo àwọn èèyàn, a rọ̀ wọ́n pé kán jọ̀ọ́ àwọn tó níbi iṣẹ́ àbáwọn tó ń lọ́jà pé kán ṣe ètò bí àwọn ṣe máa fọ ọwọ́ wọn tí wọ́n sì máa fi sanitizer tó máa fi sí ọwọ́ wọn. Ètò tó wà ńlẹ̀ tẹ́lẹ̀ wípé èèyàn ò lè lọ láti Àbújá lọ sí Lọ́kọ́jà, òfin yẹn ó yìí múlẹ̀ o. Ṣùgbọ́n nítorí pé a fẹ́ kí ètò ọrọ̀ ajé wa kó má ní ìfàsẹ́yìn púpọ̀, gbogbo ọkọ̀ tó bá ń kó oúnjẹ tàbí oògùn tàbí nǹkan ọjà, pé ọjà mi ò sọ wípé wọ́n lọ ra ata, wọ́n lọ ta ata o. Àwọn èròjà tí àwọn iléeṣẹ́ wa tó ń lò, àwọn industry wa ń lò, wọ́n yóò tó bá ń pè yẹn wọ́n jẹ́ kó lọ. Ìséde tó sì wà náà àti tẹ́lẹ̀tẹ́lẹ̀ látago 8 alẹ́ títí dé aago 6 àárọ̀ ni. A ti sún ìséde síwájú díẹ̀ tẹ́ pé aago 10 alẹ́ ní ìséde ó bẹ̀rẹ̀ títí aago 4 àárọ̀ ọjọ́ kejì. Àsọ òfin tó sọ yìí pé a gbọ́dọ̀ máa pọ̀ lójú kan náà ó yìí múlẹ̀ ṣinṣin o. Tá a bá ti ju 20 lọ tá a sì sí ilé iṣẹ́ àti lu òfin o. Ọ̀rọ̀ mọ́ṣáláṣí àti church ilé ìsìn olùkọ́ ti ṣe àlàyé fún wa, àwọn gómìnà wa àtàwọn aláṣẹ wa tó yẹ pé àwọn ni wọ́n ti ń bá àwọn àáfàá wa wọ́n ti ń bá wọn sọ̀rọ̀, wọ́n sílẹ̀ díẹ̀ ni o, ṣùgbọ́n gbogbo ètò yẹn wà lọ́wọ́ àwọn gómìnà wa, wọ́n ṣe àlàyé fún yín. Ọjà wọ́n ti ṣí ọjà díẹ̀ ṣùgbọ́n pẹ̀lú àlàyé ni o. Gbogbo ẹni tó bá ń lọ sọ́jà nísìnyí o gbọ́dọ̀ fọwọ́ ẹ̀, ó gbọ́dọ̀ fi nǹkan bo imú ẹ̀. Bá sì dé ọjà kò ń ṣe tí tẹ́lẹ̀ tá a máa pọ̀ èyí lọ́jà tá a máa àtẹ tó ń tajà ń sìn àtẹ tó ń nájà wàlá gbọ́dọ̀ bo imú wa, a sì gbọ́dọ̀ jìnnà síra wa díẹ̀. Báńkì ilé ìfowópamọ́ wọ́n ti tú wọn lẹ̀, wọ́n mọ̀ ṣiṣẹ́ látàárọ̀ dalẹ́ ni. Ìséde nìkan ni wọ́n gbọ́dọ̀ rántí pé tó bá ti dago 8 o ìséde wà o, wọ́n yóò ti kúrò níbi iṣẹ́. Ṣùgbọ́n bẹ́ẹ̀ ni pé bí ó ṣe wà tẹ́lẹ̀ kí COVID-19 tó dé ní ọ̀rọ̀ ilé ìfowópamọ́, ẹ lè gbọ́wọ́ yín, ẹ lè lọ́ọ́bẹ̀ nígbà tó bá wù yín láti gbọ́wọ́ yín. Gbogbo ilé iṣẹ́ tá à ń pè ní industry gbogbo wọn àti tú wọn lẹ̀ o láti máa ṣiṣẹ́, torí tí a fẹ́ kí n tó máa fa ebi sílẹ̀ fún àwọn èèyàn, tàbí tí ó jẹ́ pé tí àwọn aráàlú tí wọ́n nílò gẹ́gẹ́ bí oògùn nǹkan a fẹ́ kí ó má sí nílẹ̀. Wọ́n ti sọ̀rọ̀ nípa ọkọ̀ òfurufú. Ilé àní sí afẹ́fẹ́ wa sílẹ̀ títí bóyá ìparí oṣù kẹfà, kódà ó lè tó bí ìbẹ̀rẹ̀ oṣù keje, tó sì fà á ni wọ́n ti ṣàlàyé fún wa. Ọkọ̀ òfurufú ó ní àwọn òfin kan tó so mọ́. Téèyàn bá ní ọkọ̀ òfurufú tó bá lò fún bí oṣù 6 tàbí oṣù 9 tàbí ọdún kan, tàbí tó bá ti dé wípé mẹ́ẹ̀lì ibùsọ̀ tó ti lọ tó ti bọ̀ ó pọ̀, ó gbọ́dọ̀ padà lọ sí ilé iṣẹ́ fún àbẹ̀yẹ̀wò. Wọ́n wò ṣé bíléèdì ẹ̀ ṣe bí ẹ tó kó wà ní tàbí ẹ̀rọ ẹ̀. Ọ̀pọ̀lọpọ̀ àwọn ọkọ̀ òfurufú àwọn ti jókòó sílẹ̀ láti jọ yìí tí wọ́n ṣe nǹkan kan. A fẹ́ fún wọn láàyè láti lọ wò pé ṣé ọkọ̀ òfurufú yìí ṣe ó ìdà bí ó dà. Ṣé àwọn ìpẹ́ tá a bá páàkì mọ́tò gan, tá a bá páàkì ẹ̀ sílẹ̀ nígbà míì àyọ táyà àkó pamọ́, àjò epo ẹ̀, tá a bá nílò ẹ̀ ṣe wá rọ epo sí. Ọlọ́run jẹ́ ká rí jàǹbá òfurufú o. Àti pé àwọn tí wọ́n ń wa ọkọ̀ náà ó tún ní àwọn ìdánwò tí wọ́n gbọ́dọ̀ máa ṣe lóòrèkóòrè kó tó di wípé wọ́n lè wa ọkọ̀ náà. Ó tún wá ní àbẹ̀yẹ̀wò ti ìlera tí wọ́n gbọ́dọ̀ máa ṣe gbogbo ilé la fi fún wọn ní ààyè pé ó lè tó bí ọ̀sẹ̀ méjì mẹ́ta mẹ́rin kó tó di pé wọ́n bẹ̀rẹ̀ iṣẹ́. A ti sọ̀rọ̀ ilé ìjọsìn pé àwọn gómìnà wa ni wọ́n fún wa ní àlàyé tó bójú owó lórí ìyẹn. Gbogbo ẹni tó bá ń ti ìlú òkèrè bọ̀ ń sìn yìí o tó bá ti dé yóò kọ̀ lọ sí ilé àdágbé fún ọjọ́ 14. Ní ṣókí mi ṣe sọ ọ̀rọ̀ ìséde ó wà ó kàn jẹ́ pé ìséde aago 10 lẹ́ni ó bẹ̀rẹ̀ ń sìn o. Ọ̀rọ̀ iṣẹ́ wọn ní kéèyàn má jáde o tí ó bá ti sí ìséde èèyàn lè jáde kó lọ bí iṣẹ́ ó lè jáde láti ra nǹkan ṣùgbọ́n kó rántí pé tó bá ti aago 10 kó padà sílé o. À ń gbà wọ́n ní ìmọ̀ràn yìí pé ẹ má máa lọ láti ìlú kan dé kejì kódà bẹ́ẹ̀ bá wà l'Ábùjá gan téèyàn ò bá ní nǹkan mú ní Kùjé kó dúró ní Wuse tó ń gbé o. A ti sọ̀rọ̀ ti ọkọ̀ òfurufú àti ṣàlàyé fún yín bó ṣe máa rí. Mo ti ṣe àlàyé ti àná láti ìlú kan sí ìkejì náà. Wọ́n jẹ́ kí wọ́n sọ pé èyàn ò lè sọ pé òun máa lọ láti lọ kọjá nísìn lọ sí Àbújá tí ò bá ní ìdí tí ò bá ń ṣe dókítà tí ò tẹ̀sí ń ṣe oníròyìn. Àwọn àfàkì mo rò pé àwọn ìṣẹ́ṣẹ́ torí àti sọ pé àwọn oníròyìn kankan wọ́n wà kọ́bà tán bá ń lọ síbi iṣẹ́ wọn ní ṣáò wọ́n ṣe kí wọ́n lọ rí ìyàwó àfẹ́sọ́nà wọn o. Gbogbo àwọn tí a ní ilé ìtura tá ń pè ní hòtẹ́ẹ̀lì wọn á ṣí. Àwọn ilé oúnjẹ tó wà ń bẹ̀ wọ́n fún wọn láàyè. Gbogbo àwa tí à ń lọ ra oúnjẹ ń búkà wọ́n ti tú àwọn búkà sílẹ̀ wọ̀ ẹ lè lọ ra oúnjẹ ń búkà mẹ́ẹ̀ lè jókòó bẹ́ẹ̀ lọ jẹ ni o ẹ rà ẹ gbé lọ lé ni o. Ó dàbí ẹni pé gbogbo sọ ti ilé ìtura ṣùgbọ́n gbogbo ibi tí wọ́n ti ń mutí tí wọ́n ti ń ṣe fàájì wọ́n ti ilẹ̀kùn kọ́kọ́rọ́ tán fi tì wọ́n tí fún wa o ó wà ní títì o. Iléèwé tí ọmọ kékeré ní o tàgbà ní o wọn tí ì ṣe sílẹ̀ o wọ́n ti ṣàlàyé tó kún fún wa lórí ẹ̀ pé tó bá tó àsìkò á jẹ́ kẹ́ mọ̀. Mo rò pé eléyìí náà ní kókó ohun tí alága àti coordinator tí wọ́n ṣe àlàyé fún wa wípé a ṣí okùn tá a so tẹ́lẹ̀ àti dẹ̀ díẹ̀ ṣùgbọ́n ewu wà ní oko lóńgẹ́ o lóńgẹ́ fún rẹ̀ náà ń kọ́ o ewu ni o ẹ ṣé púpọ̀.
Thank you very much, Honorable Minister, Information and Culture. I now invite the Chairman, PTF, to the podium.
Thank you so much, but I'm not sure that any questions left for me to answer, just for the purposes of emphasis. I know that the question with regards to relaxation, and particularly, I think you asked whether we were going to police the states and ensure compliance. That is totally not our responsibility. It's the responsibility of the states to ensure compliance, because this is a matter of public health. And health in the Constitution is on the concurrent list. The federal government deals with tertiary institutions of health and policy directions. The state deal with the secondary structure of health facilities, and the local governments deal with the primary healthcare systems. So it's shared responsibility. And now that the transmission has gone to the community level, it is expected that the states and the local government would take responsibility and drive that process. It's very, very important that at this stage, it is their responsibility. We will continue to give guidance. We will continue to give policy directions, and they will be assisted as much as possible. And that dovetails into a question that I asked with regards to support to state governments. All the support that we've been given have gone to the states. Support from COVID have gone to the states. Because if COVID puts up a tent of 500 beds in Kano, it is for the use of the state. All the support that we've been getting have been deployed for the use of the states. Some have gone to federal government institutions in the states, but it is still for the use of the states. If you have a federal medical center somewhere in Adamawa and it receives equipment and PPEs and facilities, I want us to understand that when this pandemic or when this virus set sail on the shores of Nigeria, I was just discussing with the DG of the Center for Disease Control. They didn't have one molecular testing laboratory that could deal with it because it was a novel virus. So they had to reconfigure everything. They started with 2. Today we can say authoritatively that we have 29. This capacity built over this period of time. And all these 29 are located in different parts of Nigeria. In institutions, some that are owned even by state governments. So I want us to have a clear picture that whatever assistance, whatever donations, whatever equipments are procured, they are deployed to health facilities all over the country. And as far as support is concerned, I think the states are getting all the support that they ought to receive. But like I rightly mentioned, health is on the concurrent legislative list, shared by the 3 tiers of government. So we expect correspondingly the states to step up their action at this time, because the infections and the transmissions are now at the community level. And it is expected that they will do everything to ensure that they take over the management of, and that's what we have been talking about in the last 1 month. Ownership by the community. Responsibility by the community. We'll come to a stage, and that will now bring me to the question that Rachel asked, though Dr. Sani has answered that quite perfectly. And in paragraph 19 of my statement this morning, item 1, I was very categorical. Nigeria has not reached the peak of confirmed cases. We're still in the first wave. We've not even peaked in the first wave. The basic question that most Nigerians will ask tonight is, are we going to see an increase? Yes. Yes, there will be an increase. And I'm saying it with all sense of responsibility, because we are putting infrastructure in place that will now tell us exactly what is happening. We are ramping up the tests, first detection. And now that it is at community level, you don't wait for the people to come. The people who have responsibilities will have to go in search of likely infected persons and bring them. You detect them, you test them, you trace their contacts, and you take them into isolation and provide care for them. what you were getting when we had only 2 molecular laboratories would obviously be different with what you will be getting now that we have 29. And by the time the gene expert machines are put into use, you will be taking the testings now closer to the communities. Because these were machines that were used for the test of tuberculosis that have been used over the years. All you need to do is to recruit the people and make sure that, okay, you authenticate the test packs and deploy them to the communities. So now you are going in search of likely infected people. The numbers would increase. What will bail us out is our level of compliance. And the truth about it is that no country has been able to survive this virus just by lockdown. Very few countries. China, probably Taiwan, South Korea, mildly, because of the level of their institutional structure and discipline. We've not been able to exhibit that in this country. We've always been persuasive and engaging the people and asking them to cooperate in their own interests to ensure that they protect themselves and their loved ones. So we are at a point where we must balance, like I said in my statement, between lives and livelihood. Can we continue with the lockdown at the expense and the peril of people who depend on their daily means of... We have been able to interrupt substantially the transmission. And we can now situate the level of transmission and the burden of the transmission within 20 local governments, like we said, that account for 60% of the total figure of 10,107 that we have for today. 20 local governments. What do we need to do in that regard? It's now to apply a precision intervention process so that we can deal with the transmission at that area, in those particular localities, provide care for those that are infected, those that would fall ill, and also in place a home management guideline. Because very soon as the figures scale up, we will not be able to provide isolation for everybody that is tested positive. It's not done anywhere. We lack the infrastructure, we lack the capacity to do that. It is not even advisable. So what do we have to do? Is to provide care at the home management level for those that are well, asymptomatic. They don't exhibit any symptoms, but they dangerously transmit the virus. So I believe that we are on the same page with those of you that are covering this exercise over the weeks. We have spoken consistently. I remember on the 19th of May, in my address here, I had posited that institutions that were not covered in the first phase should begin to prepare. That the 2 weeks extension we were getting was to get them in shape to begin to prepare for eventually coming on board. And I believe directly talking to the religious institutions, the report I have and which the task force has is that they have been preparing. Here in Abuja, I can say authoritatively, the minister had sent me guidelines that were drawn in conjunction with the with the FCT administration as to how they would move into the easing and relaxation of the ban on places of worship. They're not going to open tomorrow or today. They will take time and in place these things. The guidelines we are going to issue, along with the protocols that they will go into with the state governments and the administration of FCT. And I believe at the Governors Forum, they have been doing that too. They have been talking to the religious bodies in their various states and collectively, even at the Governors Forum, conscious of the fact that it is their responsibility at the state level to ensure compliance of the guidelines and the protocol that we have jointly put in place. And I believe that at this moment, all we can ask for is the cooperation of the people of Nigeria to ensure that at this stage, the issue of what happens to us, collectively and individually, that responsibility should be taken with some level of diligence and seriousness. I will repeat that for a lot of people, the 273 names or figure of fatalities is just a figure, it's just a statistics. For some of us, there are faces to those numbers. People we have worked with, people we have shared fellowship with, people that have invested so much in this nation to see this nation move to the next level on the trajectory of growth and prosperity. But they have fallen victims or caught in the fatalities of COVID-19. My appeal to those of you that are watching from home and those that will read on the pages of newspaper is the fact that COVID-19 is real. It has ravaged even the most established systems of the world, and it would continue to do that until we are delivered by way of vaccination or any form of cure that is gotten. But I believe that with the resilience of Nigerians and with our steadfastness of being compliant with the guidelines that have been put in place, we will reduce drastically the scourge of COVID-19. I want to thank you.
Thank you very much, Chairman PTF, on COVID-19. That brings us to the end of today's national briefing. But a number of messages have come out. We can pick and choose from all sides of the document that has been read to us. But I want to highlight 3 of these messages today. 1, Nigerians have just been presented with details of a coordinated effort for advancing into phase 2 of the East lockdown, which is subject to review. The guidelines have tried to balance between lives and livelihood. Please continue to observe physical distancing, personal hygiene, wear your masks, avoid mass gathering, stay home if you don't have any important reason to go out. 2, the focus from now has shifted to precision intervention, community engagement, and risk communication. This is a further call to duty to all Nigerians. Play your part in communication and awareness, educate yourself, and educate others. 3, Nigeria has not reached the peak of the impact of this COVID-19. There is more work to be done by all of us. Protect yourself, protect others. Know that COVID-19 is real, COVID-19 is dangerous. Take responsibility. Finally, we thank all Nigerians for their patience, for cooperation, and for understanding. Together we shall overcome. Together, Nigeria and humanity shall prevail. We also thank our colleagues from the media that have been taking this broadcast right into your homes and your offices. God bless Nigeria. We hope to see you tomorrow by the grace of God. Thank you.
The Presidential Task Force, their daily briefing just ended. Welcome back to the news. Let's continue. The Minister of Finance, Budget and National Planning, Zainab Ahmed, says without the $5.5 billion external borrowing, implementation of the 2020 revised budget will not be feasible. The minister appeared before the Senate Committee on Local and Foreign Debts to defend the proposed loan. National Assembly correspondent Ignatius Onkwo has